terms of specifically this guideline, but perhaps before I talking about what has changed in this European guideline, I would like to highlight the fact that in general, at the global level, MDS publishes evidence-based assessment of treatments. They may sound identical, but they are not. They are similar. They are based on this critical assessment of the literature. But in this case, let's take non-pharmacological treatments of PD. And then we go over to physical therapy and what's the level of evidence. And there is one final column where we describe the clinical usefulness, because there are some measures that they can be statistically significant in a scientific paper, but they might not be that helpful in the clinical setting. So we try to provide this critical evaluation of the usefulness. Guidelines are different. Guidelines are recommendations on how to treat. They are based on this evidence-based treatment. I would say that this last round of guidelines, from a pharmacological point of view, it has really addressed drugs that had not become available before. Although I would not feel comfortable in really mentioning any specific agent for obvious reasons, but there is a new generation of agents designed to improve those fluctuations that I was describing related to levodopa, that they have been assessed in these guidelines. And regarding deep brain stimulation, a lot of new data have been incorporated into this new paper, especially the role of DBS in patients who have an earlier disease. In the past, we used to leave this procedure for people who had a more advanced stage. Right now, there is a more understanding what is the role of DBS in an earlier stage. So those are the two main issues. And also, there is some description as well of infusion therapies that previously we didn't know much, but now we have more data on that. So I would say that these are the three main areas in this new paper.